Ooh, I should have I should have bought a hat. Hang on a second. I think we all need a laugh, so I should be wearing a hat. That's not going to stay on, of course. So I'm going to get this big guy on. There we go. All right. Because, it's a national emergency, isn't it? It's a national emergency. So we all need to laugh. And of course we could, I'm always backwards. Yeah, there we go. All right. So let's see. Yeah, we could talk forever. And in my household, people have the TV on a lot. Getting worse. I look like Sherlock Holmes now. About what's going on. Yes, there is a terrible flu pandemic, and people are disturbed and panicking in some cases, and there's some things we can do about it, and there's one important thing we should do about it is take a deep breath and be hopeful, as we should be, healthcare people, and follow some good instructions. Okay, so we talked about this a little bit last week, so I don't want to expound on it. I really want to talk about what's going on at work for healthcare workers, and let you know what I'm what I'm aware of that is an ongoing thing in the healthcare realm, more poignantly in the healthcare realm, and how it affects so many people. And it happens in all jobs, because we're human beings and we have to learn to work together. But so I want to get to that. But I will talk about COVID-19, the coronavirus that began in January in China and is now a pandemic. Okay, it is a very, very severe virus, and we don't have really strong antiviral medicines. We do have vaccines, and so we don't have one for this one. We're working on that. What we do know hasn't changed, and what we don't know is going to be important to find out, and that's what our best, I don't want to say experts, but experts, of course, at the World Health Organization, WHO, and the CDC, Center for Disease Control, and the best minds and the specialists are working on it. But what we do know, and the general healthcare population, and the general population is getting a lot of information, is that the signs of this particular flu are fever, cough, and difficulty breathing. And so containment has been a huge thing, and I think that's really alarming people. I grew up in the 60s and 70s, and I remember strikes, milk strikes, and what other things. I particularly remember milk strikes because I was in a family of 4 kids. It was a relatively small family in my neighborhood because there were many families with bigger numbers. People around the corner from us had 10 or 11 kids in their family. Most of my neighbors were 3 and 4, but a lot of kids I went to school with were from much bigger families. And so the milk strikes, the milkman, we used to get milk from the milkman. It was in the supermarkets as well, but we had a milkman, we had I think in Italian they called it Javel. My grandmother looked forward to seeing the Javel man once a week. We had repair people that used to come around with their carts and trucks and sharpen scissors and knives. Who else delivered? We had all these delivery people. It's kind of cool. I was in a semi-suburb, really city limits, and so the milk strike, people with their large families, boy, we needed a lot of milk and a lot of bread. That's how they kept us, our tummies full. and pasta and so forth. Anyway, so I remember those days. I remember as I got older in the 70s, gasoline strikes and gasoline lines and so forth. So people want to take care of their own, and that is usually family first. But in the healthcare realm and in a good community and neighborly way, we have to really, yeah, of course, take care of yourself, because you're no good to anyone if you don't. But check in on your elderly neighbors. Check in on, you know, young families with small children, and see if there's any way you can help. My lovely neighbors, I have just a few neighbors on my block, and they check in, make sure my Wi-Fi is working, and see how my daughter is. She's due to deliver any day. And another lovely couple picked a bunch of oranges off their tree and came and offered us some, and that's great. Vitamin C for your immune system. We're doing a lot of garlic in our family as well. And so what we do know, symptoms are fever, usually higher, 102, 103, 104, fever, cough, and difficulty breathing. If you have any of those symptoms, go see a physician, go to a clinic, get looked at, and they will test you. The tests hadn't been available in the last couple of weeks in our hospitals and clinics, and are now starting to be available. So if you don't have those symptoms, you just don't feel well, you have a scratchy throat, stay home and take care of yourself. Gargle, rest, amuse yourself. Don't try not to stress out. I mean, it's a bad virus because it hits very hard, and the breathing is a big issue. But containment is our best defense at the moment. So I'm looking at it because there's a lot of educators in our family. The schools are closing. A lot of the crowd places where you go where there's a crowd, 50 or more, the movie theaters, the stadiums, the concerts and so forth are closing down. Not the time to go to Vegas. Well, I don't know if you have time on your hands and you want to do that, but a lot of the shows, the wonderful shows, are shut down. So, so that's what we know. Use your universal precautions. Cough into your elbow. If it's a suspicious cough, see your physician, see your providers, and just take good care of yourself and follow those. Wash your hands a lot. Like I went to the supermarket, my cousin needed some things, and they didn't have hand sanitizer, so I grabbed a piece of newspaper and put it on the cart, did my shopping, got out to my car, and washed my hands. If you don't have hand sanitizer, take your bottle of water, and as I taught my cousin, she has some brain issues, I said, when you clean your hands, sing happy birthday to yourself. You know, so rub and scrub and get in all the nooks and crannies and do a good job of washing, okay? And try not to touch your face and your nose and your ears, and, you know, just be prudent and clean. Okay, so today at work, how are we behaving at work, okay? And who notices how we're behaving at work? So there's no I in team. When you go to work, you're part of a team. It's not about you and your personal issues. Leave them at the door. Be a good employee. You know your job. Do all that you can to do a good job, to be timely, to be efficient in getting things done in a timely manner. And take a breath. Take care of yourself. And ask for help when you need it. If you feel like you're running behind, if you're passing meds, or if you're in a practice where you have, you know, so many patients to see every 15 or 30 minutes or whatever, be good to yourself and be good to others, okay? If you run behind, just let someone know. It's not the end of the world. It's better to complete the task than to skimp on what needs to be done, okay? So I'm going to read something to you, which inspired me to talk about this, because today more than ever, we need to be good team members. Our comfort level, or stability level, or emotional level is huge in how we perform, how we feel, and how our health goes, right? I mean, we know smoking, too much smoking, addictions, drugs, alcohol, overeating. We know those things are bad for us. We know we also have family histories that affect our health. If everybody, all the adults in your family were diabetics, you're much more at risk to become a diabetic. If everybody in your family had heart disease, cancer, whatever, you're more at risk, okay? So we have to do what we can help ourselves. We can't change those things, but we can do what we can with what we have to work with. And just as terrible as smoking and drugs and overeating and dangerous hobbies, hiking mountains or whatever, just as dangerous as those things are, is stress on our system, okay? It has a physiological, mental, physical, and emotional effect on your body and your healing and all of it. So I read this. I have this wonderful calendar that some lovely friends of mine gave me. It's geared right towards nurses. It's called a nurse's calendar. And each day there's a story, and each day there is a little something to keep you busy, a little like puzzle or joke or something. So I'm just going to read you the short story, and let me know if this brings anybody to mind, or if you were ever like this one day. Because you know what? We're not always our best every day, right? So don't think if you've made mistakes and if you're not the good guy today that you can't change it tomorrow or in the next hour, right? So we're all capable of change, right? So the title of this little story is called, Are You an Annoying Nurse? Second part of the title is MIA employee, missing in action employee. Does that bring anybody to mind? Oh my gosh, the people that took way more bathroom breaks than they seem to need. The people that you work with that don't answer the beeper or the phone. The MIA employee, okay? So it starts off, while everyone else is busy handling patients, charting, or dealing with family matters, because your patient's family is part of your practice. You have to deal with the family as well. You're never anywhere to be found. You're either taking a long lunch, on one of your many breaks, or calling in sick again. While nobody wants to see you chained to your routine, your unattended patients and uninformed doctors makes you seem lazy and forces the workload on other nurses. You might think it's nobody else's business, but that's the thing about work. Everything is everyone else's business because we're a team, right? People are constantly comparing themselves and their peers and superiors alike, to their peers and their superiors alike, and will grow to resent people who don't seem to be putting in a full shift's work. Wondering if people notice how often you're outside talking on your cell phone or leaving early? Stop wondering. They notice. You've hurt the team. You've disrespected the team. You didn't do a good job. You didn't do a good job. Things left undone, it's not completing your job. And then that's more for your supervisor to deal with. And if she doesn't deal with it, then he or she's not doing a good job. Okay? So somebody notices, and we don't want to be the annoying employee. We don't want to be the annoying supervisor. We don't want to be the MIA employee. Today, more than ever, with a crisis going on, our demeanor, our presence, our attention to detail, our openness to our to team members' needs, because everybody gets different assignments. One day the doctor on the East Wing is going to be busier than the doctor on the West Wing. One day the doctor in the clinic has needier patients or sicker patients, and so if if you're done with your work, and double check yourself, make sure it's complete. Say you're in a clinic situation, okay, and you're bringing in patients and you're weighing them and you're doing your basics, and then maybe some vaccines are needed, or a pneumonia shot, or direction to the lab, or referral. You get that all done, right? You get your paperwork done, you're doing things in a timely manner, and then you realize you have some breathing space and you're like 25 minutes away from your lunch break. So you look around, you check in with your soup. It might be the doctor, it might be you check in with your team members. Maybe you're the RN in charge and you have medical assistants, med techs. Who else might you have? LVNs might be on. It depends on the practice, depends where you're working. Check in with everybody. Say, hey, I got a few minutes. What can I do for you? What can I do for you? And they're like, oh, thank God. Can you get a warm blanket for the patient over there? Or can you call so-and-so in and just get their vitals? Be a good team member, okay? And I'm trying to think, I really think I am a pretty good team member, but I'm sure I had days where my attitude wasn't good, or I spent too much time on one project and slacked on the other, delayed on the other. Try not to be that person, okay? And you have every opportunity each day to improve, to be your best self, to be a good team member. Don't be the annoying one. Don't. It hurts the whole team. And if you don't think anybody's noticing, if you think, you know what, it's cool now, everything's quiet, I'm just going to run and smoke that cigarette, or go to my car and, make that call that I've been trying all week to make. No. If you need time out, just ask. If the answer is no, oh well. You'll get your time out at another point. But yeah, be a good team member, okay? Most of us know our job. If there's any confusion, you know where to go for help. You don't go to somebody parallel on the team. You go to a supervisor. You go to that level. Just say, I did work with this particular piece of equipment about 2 weeks ago, and I can remember, the start and the end, but there's something in the middle I feel like I'm missing. Can we review that? And if it's not timely, they'll say, no, ask so-and-so to do it, and then let's meet after lunch and we'll go over it again, okay? There's no shame in not being perfect, but there is shame and disappointment. I guess that's the word. You will disappoint your coworkers. You will disappoint your team if you go MIA, or if you do half of your job instead of all of your job. I just thought that when I read that, and that was my little there. It's a daily calendar, and it has a story. Each day has a story or a tidbit about health worker. Let's see. Let's go back. A proverb. This was a proverb a few weeks ago. Medicine that heals is not always sweet, and caring words are not always pleasant. That's a proverb. So, a doctor having to say, I'm sorry, the results came back from your biopsy, and it is a malignant tumor, right? Your doctor cares about you. Now the next piece of conversation are going to be some of the options, what you can expect, how they can help, what the road ahead looks like. So yeah, medicine isn't always sweet. Oh my gosh, there was some medicine they gave me when I was a kid. It used to give me nightmares, tasted like, it was like this, it was lemony, thick, it was something for asthma or something. It was horrible, it gave me nightmares. But yeah, medicine isn't always sweet. In medicine, talking about specifically about medicine, the product, but medicine, the world of medicine, is not always sweet, because we talk a lot about wellness, and we will talk about wellness again when I get my friend Mary on here, who's running a wellness business, who is a fabulous RN. Yeah, healthcare is not always about wellness. We're there too when people aren't doing well, when they have a broken bone or they have a disturbance somewhere in their system. And often we see this in my practice, in many years of practice since the 70s, the 1970s, that one system affects another system, like diabetes, for example. Diabetes. Diabetes. I mean, it has a huge effect on the vascular system. The insulin-resistant patient has more difficulties with just about everything than a patient without diabetes. So, you know, the eyes, the extremities, the heart, so many things. So I always seem to get way off track, but my topic today was today at work. How did you behave today at work? And applaud yourself when you do a good job, because not everybody's always going to tell you when you're doing a good job. They seem to always notice when you're not doing a good job. That's kind of a bummer. And if you're somebody in charge or you're just part of the team and you notice somebody doing that extra effort thing, mention them. Say, oh, you know, Jim, I saw you helping those people get their orthotics, you know, and being so patient, and whatever they did, holding the door or taking extra moments, or that they were smiley all day. Okay, I'll tell you something really sweet that happened. I accompanied my husband to see his doctor, and so I assume a medical assistant. She was just beautiful. I mean, she wasn't like a model, but she was good looking too, and she was put together nicely. And it was early in the morning, and she didn't have a lot of makeup on, but she looked fresh, and she wasn't 20 years old. She just looked, you know, her scrub top and bottom were clean and they matched, and she had a good strong walk about her and a smile on her face, and her hair was neat. And she said good morning, and she weighed him, and she looked him in the eye, and then she took his vital signs. She brought him back to her room, and I was kind of quiet because I promised I would be quiet unless everything wasn't addressed, and then I had my list. But I wanted my husband and his physician and his caretakers to, you know, do what they needed to do. And so she did everything she needed to do. She asked her questions. She entered things in the computer. And when she was about to leave, my husband said, oh, I've noticed something. Can I tell you something I've noticed? And she said, sure. And she stopped. And she looked at him. And he said, I noticed you're not wearing gloves and you're not wearing a mask. And thank you for that. That makes me feel so human. I mean, he wasn't really sick. We were there to review some labs with the doctor. And she said, oh, thank you. You know, she did wash her hands. We didn't see her wash her hands before she weighed him, but when she entered the room and sat him down, she washed her hands, and then she proceeded. So a few minutes later, maybe 8 or 10, the doctor comes in, another lovely, fresh-looking, not a 20-year-old physician that I had not met, but my husband had met her and felt really good having this physician on his team. And she came in. First thing she did was said hello and proceeded to wash her hands. She also was not wearing gloves or a mask, and she addressed it. She said, okay, we're here today to talk about blah, blah, blah in your labs. And she said, and I'm not wearing gloves or a mask because I spoke to blank, I can't remember her name, Maria, I think, because she said you really appreciated that she wasn't wearing gloves or a mask. But she gave some instruction. She said, I want you to know that right now we are instructed to wear gloves and a mask because we want to protect you. We feel fine. We wouldn't be here at work if we didn't feel fine. We weren't well, but we're protecting you. You know, you may be vulnerable. You may have a low-grade fever. You may have a wound. You may have something. So, you know, please, Mr. King, she said to him, understand that when you see people wearing masks, we do that, much of that, to protect you, not because we're afraid of you. So I thought that was so fabulous. He enjoyed having two people take care of him that could look him in the eye, not wear a mask, not wear gloves. So now we completed our visit, and it was really wonderful. A lot of questions were answered, a lot of plans were made, a lot of instruction was given, and we're about to leave, and the door was open, and the doctor said to my husband, "Oh, I want to tell you something." And she had a good laugh, a good giggle. And I stayed where I was. I was nearly out the door, and she said, "No, come back here." She said, "You both are going to laugh." She said, "I want to tell you when you go out there," because we came in pretty early, so the full team wasn't there. She said, "I just want to warn you, everybody is going to be wearing gloves and a mask." It was just, a clinic setting, many doctors, pretty good sized facility. And she just was cheerful about it. Like, I'm trying to talk to you about serious stuff. And it's almost, tomorrow is St. Patty's Day. Why not wear some green? So have a good time. Be a good employee. Appreciate people when you can. And then if you're not great today, just do better tomorrow. Okay, that's the best I can tell you. Employees and employers, it ain't easy. We're in the healthcare industry. We're at risk a lot. I never really thought about it so much when I was like in the hospital on a regular basis as a nurse, as an RN. I knew I was coming up against things, but I didn't overthink it. I might have had a nightmare or two about gunshot wounds or whatever. But for the most part, you just go in and you're trained to deal with this. You've got your universal precautions. You've got your, compilation of information. And this doctor was wonderful too. When we were reviewing my husband's stuff, she goes, because he wanted more information about the couple of meds he takes. And, "Oh, if you want me to take this new one, what's the interaction? How's it going to affect him?" So she goes, "Oh, look at that." She gave us our discharge instructions with a lot of med information. And she laughed at herself. Who can remember all this? No, of course. Did we nurses, when we were working at the nurses station or in the clinics, we had reference tools. I mean, there's many medicines that we give on a regular basis. The cortisones, the Solu-Medrols, the antihypertensives, the insulin. We have a lot of information about that. But guess what? Hundreds and thousands of other meds and treatments. We just don't have it right there. So we have references. We take a breath. We don't know it. We check. This is a great time of information for all of us. So it's okay. It's okay. You're not a computer. We have computers, right? We have books. We have reference. We have coworkers. We have team members, and we have supervisors, and all of that. It's all good. It's all good. Okay? Don't be panicking. I wanted to say this, with the school shutting down, with the nation in a new historical place, 2 months off. Remember when you were a kid? We pretty much had summers off, right? School let out where I lived on the East Coast late June, mid to late June, and we didn't go back till after Labor Day. So we had little more than 2 months off, and so we're getting summer break early, right? And do the simple things. Ride a bike, take a hike, walk on a beach if you're near a beach, walk the dogs, reread a great book, talk on the phone, catch up with friends. There's so many things you can do. Stay away from crowds, do all that stuff, stay safe, and I will talk to you soon, okay? Thanks so much. This is Rita at Gold Medical Jobs, and we are here to get employers and employees to find one another, and that's good too, okay? Thanks a lot. Bye-bye.